Hi class, as promised, I have a video for you about how to choose an EBP clinical question. So this is part of week 3. In week 3, you will have been asked to look at evidence-based practice, and we have a discussion that will look at evidence-based practice and an assignment about evidence-based practice. So really this week, what we're going to do is we are going to look at how to develop a PICO question. So if we go and we look at EBP culture and what makes up evidence-based practice, we see that at the top is research evidence and evidence-based theories, clinical expertise, and patient preferences and values. So this kind of goes back to us talking about how there's positivism and constructivism. So if we look at a positivist point of view, we have facts and relationships between variables that are very concrete, and they do not involve having any kind of interpretation to them. A plus B equals C. But constructivism is where we do look at relationships between variables, and we say that people might interpret these relationships and the outcomes differently based on their own worldviews, personal preferences, cultures, and issues like that. So we see when we're looking at evidence-based practice and high-quality patient outcomes that all of these things really do matter. So to find a PICO question where we are trying to ask a question of how are we doing things in practice, we ask a clinical question. It's also known as a PICO question. So it's different from a research question. A PICO question is something that's answerable. There is research out there to answer the question already. So that's really important. For your EBP assignment, you will be asked to actually develop a question that you can find an answer to. If you develop a question that there's no answer to, then you really need to do research instead. So there's many resources for evidence-based practice. I just want to go through a little bit about some of the readings here. So if we look at, I would like for you to read on your own these first 3 articles. And really, if we look at the first one here, it just says essentials in igniting a spirit of inquiry. So it goes through here and it will bring up this context of caring we just saw here, and really says that as a nurse, we perform interventions every day, and we should ask whether these interventions are things that we should be doing or shouldn't. I was just looking up some information about these latest statistics here, but really we see here the 3rd leading cause of death in the US is because they are inadvertent medical errors. And this picture here just shows this gal who was 2 years old and had just gone through treatment for cancer, and she had been successfully gone through the treatment. She was going to have one more round of chemo, and a pharmacist technician gave her 20 times the amount of sodium chloride than normal, and she lost her life because of that. So there's many things that I think we see on a daily basis when we're out there taking care of patients where we say, like, is this really the right way to do things? Or should we be looking at why we're doing this? We really need to establish in our as a master's prepared nurse, a culture where we are continually challenging the status quo. So these are great articles to preface evidence-based practice, and then this one here, asking the clinical question, a key step in evidence-based practice. That's key reading for this week here. Pollitt and Beck do a wonderful job in their chapter 2 as well. So you can look through here, read this, and it goes through a case scenario for rapid response teams, and it shows you how to ask a PICO question. And it also tells us a little bit about the different types of PICO questions. So we can have a question that is looking at different types of intervention or therapy. We can have questions that look at etiology and to determine risk factors and causes for conditions. There are some for diagnosis and diagnostic testing, prognosis and prediction, and also some that are meaning. So this is important really to identify the type of question you're asking, because as we see later, that will direct us towards what type of evidence that we need. And then you can use this template here to develop a PICO question. So resources for evidence-based practice. So if we were saying that you need to find a question that you can already answer, you need to have high level of evidence to actually put things into practice. So high levels of evidence, if you look on the your Pollitt and Beck book, right in the front cover there, they have a little pyramid, a hierarchy of evidence, and you can see there what sources of evidence are the highest. And you will see that systematic reviews are one of the highest levels of evidence. So systematic reviews are based on the results of numerous individual primary research studies. So a clinician will ask a question themselves and say, you know, what is the effect of having a rapid response team? And then they'll go into a database and collect all the articles that were done that tested rapid response teams, and then they will systematically go through all of these articles and come up with a conclusion at the end, saying whether there is evidence for this or not. So there have been so many systematic reviews done on different topics that sometimes they'll even take multiple systematic reviews and compare the results of those, and those are called meta-syntheses. And then if they take if they look at a qualitative question, they will compare a bunch of systematic reviews done on a qualitative topic, and that is called a meta-analysis. So there's systematic reviews can be found in Cochrane reviews, AHRQ, Joanna Briggs collaboration, and the Campbell collaboration. So I think in, this is week 3 here, you have some resources here for some guidelines there, and other systematic reviews are available in there. So go back to my PowerPoint here. You can also find evidence for clinical practice within clinical practice guidelines. So as a diabetes educator, I'm always looking at the standards of medical care for diabetes management. And within this guideline, there are multiple recommendations, and there are citations behind each one of these that do tell me where the source of evidence is, and it also lists the level of evidence. So not all guidelines do that, but some of them will do. So you can look in some guidelines or care bundles and read through those and see if they do give the source or the reference for where they are why they are recommending this practice and the level of evidence. So you can look for guidelines in the National Guideline Database, Nurses Association of Ontario, this Translating Research into Practice database, guidelines, the EBM guidelines, international networks, and on page 28 of Pollitt and Beck, there are some resources there for you. So resources for EBP, you can look at different synopsis of systematic reviews in clinical evidence, evidence-based nursing. There's all these different publications. And so I think that we have a lot of resources available for finding out what has been well researched and what hasn't. So really some of the questions are, how do I even formulate a question or come up with the idea for a question? So you go into here, the resources for finding EBP ideas. You can go into there, and there are some Western Institute of Nursing conference proceedings. So you can go in there and you can see what kind of current things nurses are presenting at these conferences. There's the top research studies of 2015, 2014, 2012. These I always think are really interesting. So these are just some ideas about, they're called POEMs, Patient-Oriented Evidence That Matters. And so then they go in through here and they talk about respiratory tract infections, for example. Do negative rapid strep test results need to be confirmed by culture? And then the answers to all of those. So you can look through there and get some ideas. They're pretty interesting. And then there's those for the last few years. This is De-Implementation Science, is really a great read. It's about what kind of interventions are really contradicted, unproven, and maybe should definitely be questioned. So they go through a lot of different things in here. Priority should be given to practices where the present evidence base is the weakest. So just how to prioritize those. And then there are a Choosing Wisely website that comes from the American Academy of Nurses, and 25 things nurses and patients should question. So it goes through a list there of those. So these are just some things that can give you some idea. If you go to some of the nursing quality indicators, anything that's a quality indicator for nursing, has some evidence behind it, such as nurses' role in preventing pressure ulcers, urinary tract infections, patient falls, just an example. Okay, so if you look at these resources, read those articles, you should have some clear guidelines on how to develop a PICO question. I will post these slides for you as well, but it has the steps here for formulating a question. So review the evidence and see what recommended practices should be. Look at where you work and see what's being done, and think about any gaps between those. And I just had an example here when I brought my mother to the doctor, and she was in there and she had some labs done, and they took the labs there and they showed that her fastum serum blood glucose was 112. She was just sent home by her practitioner with some instructions to lose weight. And so my mom is also a nurse. I thought she really might do well with some evidence, or if I just would tell her something, she might not listen. But if there's something written about best ways to lose weight, she might follow that advice a little bit better. So I did look into Cochrane database and looked at diabetes prevention and found 13 results. And there are, the American Diabetes Association has an article about preventing diabetes in seniors. And so when I kind of looked at this whole situation, I said, well, I can use this to really ask a clinical question and establish the status quo. So my PICO question, my P, population in older adults with prediabetes. My intervention, or my I, will recommendations for making lifestyle changes plus a referral to diabetes prevention. C, compared to those with lifestyle changes, recommendations only. Will the outcome, or the O, will this result in decreased risk factors for developing diabetes and over 1 year? So that's just an example. There's 1,000 other questions that you can ask, but hopefully this info session will help with guiding you to find a PICO question. And I really recommend you going through the readings for this week. Post your PICO on Wednesday in your discussion, and we can get some feedback from your classmates there about what they might see in practice. And then when you turn in your PICO question to me on Sunday, I'll be able to give you really some individualized feedback on the PICO question, if it is an answerable question or not. The feedback should be given in the discussions and also in your assignment that you have due this week. So hopefully that it makes this week 3 in the EBP step 1 of asking a clinical question a little bit more clear for you guys. If not, as always, send me an email and I will try to get back to you as soon as possible. All right, take care.